Today, we're diving deep into the science of male infertility. It's a topic that's way more common than most of us think, and it's often really misunderstood. But as you're about to see, it's not just about having a family. It can actually be a key indicator of a man's overall health. So, let's get right into it. All right, let's kick things off with a number that really puts this whole conversation into perspective. 50%. That's right. For about half of all couples out there who are struggling to conceive, a male factor is either the main reason or at least a big part of the picture. So this is not some rare niche problem. It's a shared challenge that affects millions. So to wrap our heads around all of this, we're going to follow a really clear path today. First, we'll look at why infertility is such an important health indicator. Then we'll try to decode the causes, follow a doctor's diagnostic journey. It's like detective work. And then we'll explore the paths forward before taking a peek at the really cool future of fertility science. Okay, first things first, let's completely reframe how we think about male infertility. Seriously, it's so much more than just a reproductive issue. Think of it more like a vital sign for a man's overall health, and the data, well, it reveals some pretty surprising connections. Globally, infertility is a big deal, affecting somewhere between 8 and 12% of couples. But here's the kicker. Look at that trend. Data from the Global Burden of Disease Survey shows that male infertility isn't just common, it's actually on the rise, taking up by almost 0.3% every single year. That's a steady, consistent climb. And this is where it gets really serious. This isn't happening in a vacuum. Study after study has linked male infertility to a whole host of other health risks. We're talking a higher risk of mortality, certain types of cancer, and metabolic problems like diabetes and low testosterone. It's almost like the body is sending up a flare, a powerful signal that something else might be going on under the surface. And get this, the implications don't even stop there. We're now learning that a father's health can actually have what they call transgenerational effects. That means things like his diet or weight can influence the health of his future children through subtle genetic switches. It just completely underscores how critical paternal health is, long before conception even happens. So what's actually causing all this? Well, that brings us to our next section, decoding the causes. And honestly, it's a lot like putting together an incredibly intricate puzzle with pieces that range from our own genetics to our day-to-day habits. This chart here gives us a fantastic bird's eye view. Now, those two biggest slices of the pie are really the key. Varicocele, which is basically a type of varicose vein, is the single most common cause that we can actually fix, and it affects about 40% of men with infertility. But then you have that other huge slice. 30 to 50% of cases are called idiopathic, which is just a fancy medical term for we don't know the exact cause. We can pretty much sort all these causes into three main buckets. First, you've got congenital factors, stuff you're born with, like certain genetic conditions. Second, there are acquired factors, things that happen to you during your life, like an infection or an injury. And third, you have that massive idiopathic bucket, which we're finding is heavily influenced by lifestyle choices like diet, smoking, stress, and even toxins in our environment. Now, you might stumble across some really intimidating medical terms, like this beast right here, oligoasthenoteratozoospermia. I know, it's a mouthful, but don't worry, it's actually just three Greek prefixes all mashed together. Oligo means low count, astheno means they have poor movement, and terato means they have an abnormal shape. So it's really just the technical way of saying all three main sperm measurements are off. So with all these potential causes, how do doctors actually figure out what's going on? That brings us right to our third section, the diagnostic journey. And it really is like a step-by-step process of investigation and discovery. The whole evaluation is super methodical. It always starts with a really detailed medical history. Then you move on to the cornerstone of the whole workup, the semen analysis. After that, there's usually a physical exam and some hormone tests. And only if they need to dig deeper, doctors can order more advanced genetic tests or imaging. One of the most wild things about all of this is seeing how the very definition of a normal sperm count has changed over time. Back in the 90s, the World Health Organization said the lower limit was 20 million sperm per milliliter. Fast forward to 2010, and they dropped that number down to 15 million. This reflects, one, a better understanding of fertility, but also what some studies suggest might be a real global decline in sperm counts. And this is absolutely crucial to remember, a semen analysis has its limits. A normal count doesn't automatically guarantee fertility, and a low count doesn't mean it's impossible. It's really just a numbers game.
a measure of quantity, but it doesn't tell you the whole story about the quality of what's inside. And that's exactly where these more advanced tests come into play. A basic semen analysis tells you the what, how many sperm are there, and are they moving okay? But something like a sperm DNA fragmentation test tells you the how, as in, how good is the precious cargo? Is the genetic package inside that sperm actually intact? It gives you a much, much deeper look at sperm quality. Okay, so once a diagnosis is in hand, what's next? Well, that takes us to section 4, finding a path forward. And the good news here is that there's a huge range of options, from pretty simple lifestyle changes all the way to some seriously advanced technology. Right, so treatment is definitely not a one-size-fits-all kind of thing. For many, it can start with just improving your lifestyle. For other specific issues, there are medical therapies or even surgical fixes that can be incredibly effective. And then for the more challenging cases, we have assisted reproductive technologies like IVF, which are just powerful, powerful tools. Let's circle back for a second to that varicocele we talked about, that really common fixable cause. Surgically repairing those veins can make a huge difference, significantly improving semen parameters. And for some couples, that one single procedure is enough to help them conceive naturally without any further intervention. The science here gets even more precise when you get into advanced procedures like IVF. For guys who have high levels of sperm DNA damage, for example, research is showing that sperm taken directly from the testicle often has better genetic quality than ejaculated sperm. Why? Because it avoids any potential damage it might pick up on the long journey out. It's incredible stuff, and it can lead to better outcomes.
So where is all this heading? In our final section, we're going to look to the future. And let me tell you, there is some cutting-edge research happening right now that is poised to completely revolutionize how we diagnose and treat male infertility. One of the most exciting frontiers has to be what scientists call omics. That's things like genomics and proteomics. By using next-generation sequencing, they're starting to identify brand new genes and molecular markers tied to infertility. And what does that mean? It means much more personalized and precise diagnoses are on the way. Artificial intelligence is also starting to make its way into the fertility lab. Think about it. Machine learning algorithms can analyze sperm with a level of detail and consistency that, frankly, just surpasses what the human eye can do. This could be a game changer for helping embryologists pick the absolute best sperm for assisted reproduction. And then, for the most severe cases, where a man produces no sperm at all, the ultimate moonshot is regenerative medicine. Now, it is still highly experimental, but researchers are actively exploring how to use stem cells to one day, maybe, rebuild the entire sperm production process from the ground up. And all this brings us to a final, really crucial thought. Male infertility is so much more than just a number on a lab report. It's a window into our genetics, our metabolism, and maybe even the future health of our kids. So the big question we're left with is this. As we continue to decode this intricate biology, how might a better understanding of male reproductive health reshape our entire approach to preventative medicine and lifelong wellness for everyone? Thanks for joining me for this explainer.